Again, I want to thank the organizers for inviting me to present this Meliar lecture. I'm very honored to present this lecture. The topic that I chose for this lecture is Parkinson's disease and essential tremor, which is a topic that has been of interest to me over my whole career, basically. And it's also a topic that was of interest to Meliar. So I had the opportunity to meet Meliar when I was a visiting medical student at Columbia in 1973, I believe. And the initial encounter did not go all that well. I was instructed by my chief resident at the time as a medical student to call the attending after finishing the evaluation of the attending's patient. And this happened to be Dr. Yar's patient. So I called him, and he was not very happy with my call because it was at 11 p.m. and I woke him up. But the following day, he apologized, and we subsequently became friends. And we have had the opportunity to share many experiences together, and also sharing many well-known patients. So I'm grateful to Dr. Yar for getting me started in the movement disorder career, and for interacting with me over the years before his passing in 2004. Now, one of the last papers he wrote about a year before he died was this paper called Co-occurrence of Essential Tremor in Parkinson's Disease, Clinical Study of a Large Kindred with Autopsy Findings. And this was a very important paper for me, because this is the area that I've been very interested in. What is the relationship between essential tremor and Parkinson's disease? So in this large family, as you can see, there were 5 generations, 36 members. 11 had a tremor of the limbs or head with onset at an early age. And there were some additional features, including focal dystonia. But 3 brothers had evidence of Parkinson's disease, and 2 of the identical twins came to autopsy, and they were examined and were found to have pathological features of Parkinson's disease. So Dr. Yar and his colleagues concluded that this unusual set of clinical and pathological circumstances can hardly be attributed to chance occurrence, and raised the question of a specific genetic mutation or clustering, which may link ET, essential tremor, with Parkinson's disease. These are the autopsy findings. You can see the evidence of Lewy body pathology. And in fact, the brains that were examined from this family had the typical findings of Lewy body pathology, as well as alpha-synuclein pathology. So this at least suggested that families in whom some members have essential tremor and other members have Parkinson and others have a combination, may have an underlying Lewy body pathology. This is from a paper we published in 1997, where we looked at these large kindreds of patients with essential tremor. And one of the striking findings from these studies was the marked heterogeneity that we saw within these families. So while there were some families, like the kindred B, where there was just pure essential tremor and no associated movement disorders, the other 3 kindreds had a combination of essential tremor, dystonia, and Parkinsonism. And this is especially illustrative in kindred D. This is from the family reunion, and this is me when I still had black hair. So this is the large kindred. 68 out of the 46 individuals who we examined had tremor. The mean age was 52.4, and many of these individuals had additional features besides essential tremor, such as dystonia, Parkinsonism, and other features. So that suggested that essential tremor can be a very heterogeneous disorder that can occur in isolation or in combination with other movement disorders, including Parkinson's.
Right. And how old are you, sir?
60.
So I just want to illustrate this with this patient, 60-year-old man who had an action tremor since age 12, had a strong family history, and 1 year a rest tremor history with progressive slowness.
Significantly.
Okay. And then tremor when your hand's just sitting there? Do you think you noticed it within the last?
Specifically, a problem within the last year.
Okay. Other things, any problems with slowed movement or anything else?
Yes, slowed movement.
So I don't think anyone would have any question about the diagnosis, at least clinically. He clearly had a classic rest tremor, but he also had a postural tremor. He has hypomimia, bradykinesia, and he clearly has classic Parkinsonian features. But he had a history of postural tremor since age 12. Now, some people would say this is just a coincidence, but hopefully I will convince you during the course of this lecture that it is probably not just coincidental finding, but that there are patients with essential tremor that are at an increased risk for developing Parkinson. So we first suggested that in the paper we published in 1985, where we suggested that essential tremor patients have a higher risk for subsequent Parkinson disease. And we subsequently published other papers to support this. But it was in 2015 when Alan Lewis wrote this review article and said patients with essential tremor seem to be at increased risk of developing Parkinson's disease. Surprisingly, little has been written about this clinical entity called ETPD. And he was right. There was very little written about it, and it was a controversial topic for a long time. More recently, Mark Hallett's group published some data on tremors seen in patients with Parkinson's disease, and they concluded that given the increased co-occurrence of essential tremor and Parkinson's disease, it is conceivable that patients with Parkinson's disease with a bilateral partial tremor also have essential tremor. And I come back to this topic later on. So there have been many other studies that supported the notion that there's a link between essential tremor and Parkinson's disease. Many well-documented families with combination of essential tremor and Parkinson's disease have been reported. Up to 20% of patients with essential tremor have rest tremor, rigidity, bradykinesia. Essential patients may develop nigrostriatal deficiency that can be demonstrated by a variety of dopaminergic imaging studies, and I'll show you some examples of that. And there are other pieces of evidence from epidemiological and autopsy studies to suggest that there is a link between essential tremor and Parkinson's disease. Unfortunately, the genetic studies have not been terribly informative, so I'm not going to spend much time talking about the genetics of essential tremor and Parkinson. So this was our first review article we published in 2007, where we suggested that in some PD patients, a long-standing partial tremor in the hands may precede the onset of Parkinsonian features by several years or decades. And subsequently, we reviewed this topic in 2011, 2016, and more recently with one of my colleagues, Dr. Tarakat, we reviewed this topic in 2019. So this is taken from the most recent review where we examined the phenomenological features of essential tremor and Parkinson's disease, pointing out the overlap between the two disorders from a clinical standpoint, a number of epidemiological studies that support the notion that ET patients, at least a subset of ET patients, may be at an increased risk for developing Parkinson's disease. We reviewed the imaging and pathological data and also suggested that there could be a potential genetic link between the two disorders. One of the best epidemiological studies was this study by Alan Lewis and his colleagues in central Spain, where they followed patients prospectively for a median of 3.3 years and found that patients with essential tremor were 4 times more likely than controls to develop incident PD during prospective follow-up. So these are patients who initially had essential tremor, some of whom later developed Parkinson's disease. And they concluded that the risk of developing incident Parkinson was much greater among participants with ET compared with those without baseline essential tremor. What is the evidence from dopaminergic imaging studies that there may be some dopaminergic deficiency in some patients with essential tremor? This is taken from an already old study, but it was a classical study by Piccini and others who were working with David Brooks, where they looked at fluorodopa PET scans in normal individuals, sporadic and familial PD, and then unaffected relatives that had no Parkinsonian signs. And then they had a subgroup of individuals that they referred to as isolated partial tremor, which in my view was essential tremor. And they found that this group of individuals with isolated partial tremor or essential tremor clearly had a dopaminergic deficiency when compared to normal controls. Looking at DAT scan, another way of imaging the dopaminergic system, this is taken from work of Angelo Antonini, where they showed that patients with sporadic, and especially those patients with familial ET, had a reduction in DAT on this particular methodology of DAT scan, and 19% of the patients with essential tremor had an abnormal DAT scan that was beyond 2 standard deviations beyond controls. And this was especially true in the familial ET. 33% of those individuals had abnormal DAT scan. So they concluded that abnormalities are frequent in the dopaminergic system of ET patients, particularly in those individuals presenting with positive family history, and they speculated that these subjects may be at risk for future development of Parkinsonism. They subsequently published additional studies. These are just quotations from their paper published in 2010, where they concluded impairment of DAT in the caudate nucleus may contribute to tremor onset in ET, and other imaging studies also support abnormalities in dopamine nerve terminals in patients with ET. One of those studies was a study by Lee and colleagues from London, where they looked at brain SPECT scan, and they clearly showed that patients with partial tremor or essential tremor had some reduction in that density, and this was especially true in those patients that had partial tremor and rest tremor. Again, suggesting that there may be some dopaminergic deficiency in patients with essential tremor. So they concluded that some of the patients with long history of partial tremor may acquire rest tremor in association with mild nigral neuronal loss. We also examined this question of dopaminergic deficiency in patients with essential tremor in this study where we looked at DAT scan in 39 ET patients with and without Parkinson features and 13 healthy controls. And these DAT scans were examined by blinded radiologists. And what we found was that there was a minimal dopaminergic deficit detected in the caudate nucleus of ET patients compared to controls, which was somewhat different from the pattern that we see in Parkinson's disease, but at least suggested that some ET patients have a predisposition to develop PD and underlying dopaminergic deficiency. So that brings up the question of misdiagnosis of essential tremor and Parkinson's disease because of overlapping features and absence of diagnostic biomarkers. These two most common movement disorders are frequently misdiagnosed. So ET is the most frequent correct diagnosis in patients